Welcome to the game show Name That Intervention, a game that tells you who's hurting, who's bleeding, or who's dying, and the contestants tell us how to fix them. This week's focus is on peptic ulcer disease. Please remember that all character information is fictional, and we have not violated any HIPAA rules by making this video. Hello viewers, I'm your host Tal Harrison. This week we will be intervening on patient Gail Lewis, a 48-year-old single legal secretary. Gail has been experiencing a burning sensation in her stomach for a few months and has now come to you for help. Now that we've met our patient, let's meet our contestants. We have a blue nurse, a red nurse, and a green nurse. Classmates watching this video are encouraged to play along. A prize will be awarded to a randomly chosen classmate or classmates who post their score in the video comments below. All right, let's get started. Contestants and classmates, remember that each correct question is worth 100 points. Any multiple choice questions will be awarded 100 points per correct answer. Good luck! Miss Lewis arrives at her primary care physician's office. You perform a history and physical assessment. Which information is the most significant when assessing for a peptic ulcer? Is it A, the amount of stress at work, B, the frequent use of aspirin, C, history of cigarette smoking, or D, daily consumption of caffeine?
A, because stress causes ulcers.
No, I'm sorry. It's actually B, frequent use of aspirin. Long-term use of anti-inflammatory medication or NSAIDs damages the stomach lining and can cause ulcers. Stress is rarely the cause of an ulcer, though it can exacerbate symptoms of the ulcer. During this interview, Gail reports a gnawing, burning pain in her stomach. She admits to taking aspirin for joint pain. You ask Gail to explain her pain further. Which response supports a peptic ulcer? There may be more than one right answer.
B and D. Pain is relieved with milk and she sometimes gets nausea and vomiting.
Correct! Antacids and milk temporarily relieve pain because they neutralize acid in the stomach. Also, nausea and vomiting are associated factors with peptic ulcers. But keep in mind, while milk products provide temporary relief, it may actually make an ulcer worse by stimulating the stomach to produce extra acid. And she's on the board with 200 points. The doctor schedules Gail for an H. pylori breath test. You explain that H. pylori is an infection that often causes peptic ulcer disease. What should you include when discussing the pre-procedure guidelines for the test? A, the need for a signed informed consent. B, being NPO for 8 hours prior to the test. C, not taking antibiotics for 4 weeks prior to the test. Or D, the use of a proton pump inhibitor 4 hours prior to the test.
C, not taking antibiotics for 4 weeks prior to the test.
Absolutely! Antibiotics should be held for 4 weeks so that they do not interfere with the results of the H. pylori test. The red nurse takes second place with 100 points. Gail asks what happens during the test. What is your best answer? Is it A, saliva is expectorated into a sterile specimen cup? B, the lining of the mouth is swabbed with a culture Q-tip? C, a machine is used that requires you to breathe into it for 5 minutes? Or D, a pleasant tasting solution is ingested and you breathe into a balloon?
D, a solution that is ingested and then you breathe into a balloon.
Correct! First, the patient breathes into a balloon to get a baseline sample. Then, a small amount of lemon-flavored solution is ingested, and 15 minutes later, a breath test sample is collected. A positive result will show increased carbon dioxide as a result of the bacteria. The green nurse ties, also earning 100 points. The H. pylori test was negative. Gail is now scheduled for an esophagogastroduodenoscopy in 2 days. After the procedure, quick, name that intervention.
A, inspect fecal content for blood.
No, I'm sorry. The correct answer is confirm the return of the gag reflex. While perforation, which causes fecal blood, is a concern, Preventing aspiration by assessing for gag reflex is priority. Gail is now stable and is being discharged. What teaching should be included in that discharge? Is it A, contact the primary care provider if bleeding or belching occurs? B, notify the primary care physician if fever or shoulder pain occurs? C, that small amounts of blood may be vomited following the procedure? Or D, she should eat soft foods for 24 hours following discharge?
D, eat soft foods for 24 hours after discharge.
No, a regular diet may be resumed after gag reflex returns. The client should report any of the following: vomiting blood, black tarry stools, difficulty swallowing, epigastric, substernal, or shoulder pain, as these are the complications of an EGD. Gail meets with her doctor the following day to discuss the results. He tells her that the EGD supports that Gail has a gastric ulcer. He prescribes an anti-ulcer agent, Cytotec. What will you tell Gail when she asks how the medication will cure her ulcer? Is it A, the medication adheres to the lining of the stomach? B, hydrochloric acid is neutralized within 15 minutes? C, a decrease in acid production occurs in the stomach? Or is it D, food is digested more completely and empties faster?
A, the medication adheres to the stomach.
Right again. Cytotec is a cytoprotective medication. It reacts with gastric acid to form a thick paste which adheres to the damaged gastric mucosal tissue to protect and promote healing. The doctor then realizes that he also wants Gail to take a proton pump inhibitor. What instructions do you give to Gail about Prilosec? To notify the doctor if diarrhea occurs? To take the medication whether you have pain or not? The medication will be tapered off when discontinued? Or to take the medication prior to every meal?
You should always take Prilosec even if you aren't feeling pain. B.
Exactly. This medication is taken routinely whether or not pain is present, since it decreases the production of gastric acid. What action should you include in the teaching plan? Instruct Gail to eat 3 small meals and 3 snacks each day. Discuss the importance of drinking and eating milk products. Explain the need to decrease the intake of high-fiber foods. Encourage Gail to eat as many cold foods as possible.
Well, Harry, Gail should eat 3 small meals and 3 snacks each day.
Good job! Eating 6 small portions helps increase the food tolerance and decrease the stimulation of gastric acid. The blue nurse is in the lead with 400 points. Next is the green nurse with 200 points. And in last place is the red nurse with 100. What information should you obtain from Gail during the teaching session? The amount of regular isometric exercise she does, ingestion of alcoholic beverages, the use of clothes that fit tightly at the waist, or the amount of fluids ingested before eating.
Ingestion of alcohol, because alcohol irritates the stomach.
Exactly right. Alcohol can irritate the mucosal lining. It can also erode the lining and increase acid production. Because Gail is a legal secretary and finds work very stressful and works for long hours, your priority action is to encourage Gail to resign from her job because it's stressful, discuss ways to reduce stress in her current work environment, explain that taking her medications will allow her to continue her present job, or refer her to a psychiatric counselor for guidance dealing with work.
A, Gail should decrease her stress by leaving work.
Oh, I'm sorry, that's incorrect. Encouraging clients to quit their jobs is very drastic and may cause further increases in their stress level. Instead, Gail should focus on ways to reduce stress in her current employment. 3 weeks later, Gail is admitted to the ER after vomiting a large amount of bright red blood. She is diaphoretic with the following vital signs: temperature 98.4 degrees Fahrenheit, pulse 120, respirations 30, blood pressure 88/50. Name the intervention.
D, start a large IV in anticipation of giving blood.
Correct! Gail is in hypovolemic shock. The priority intervention is to maintain circulation. The 18-gauge needle can be used to give blood as well as normal saline, which is isotonic and increases vascular volume. This is a tight race, with the blue nurse having 400 points, the green nurse in second place with 300, and the red nurse in third place with 200 points. What do you do next? Do you enter admission assessment and interview into the chart? Prepare Gail for an emergency endoscopy? Put Gail in a recumbent position with her legs elevated? Or set up the Y tubing in preparation for blood administration?
C. Place Gail in a recumbent position with legs elevated.
Correct! This intervention is most appropriate because it directly helps Gail's hypotension by increasing blood flow to the brain. Gail is moved to the ICU and given blood and protonics. You infuse it over 30 minutes. Your pump infuses according to a milliliter per hour rate. How many milliliters per hour should you set the pump at?
200 mils per hour. 200 milliliters per hour.
200 milliliters per hour.
You are all correct. You are giving 100 milliliters in 30 minutes. However, your pump is set in milliliters per hour. You can double the number in half an hour to determine the number of milliliters in 1 hour. 100 milliliters in 30 minutes is equal to 200 milliliters in 1 hour. And we add 100 points to everybody's score. Gail has blood infusing. How do you go about administering the protonics? Do you stop the transfusion and give protonics? Do you withhold the protonics until the blood is done? Do you start an IV in the other arm and infuse the protonics over 30 minutes? Or do you add the protonics to the unit of blood and continue infusing?
Start an IV in the other arm to give the medication.
You are correct! Starting an IV in the other arm does not need a new prescription. The nurse should give the protonics as soon as possible to decrease gastric acid. Gail has an endoscopy and it is determined that she needs a gastric resection. The surgeon performs a partial gastrectomy with a duodenal anastomosis. After returning to the ICU, you note that Gail's NG tube is not draining any fluid. Name the intervention.
Reposition the NG tube. No, wait. Call the physician?
Yes, you would call the physician, specifically the surgeon. You would not reposition the NG tube. The blue nurse and the green nurse are tied for first position, but the red nurse is closely behind at fourth. You also note that Gail does not have bowel sounds. Name the intervention.
It's important to determine if Gail has experienced flatulence.
No, I'm sorry. That is incorrect. If the client does not have bowel sounds, flatulence would not be expected. Peristalsis is not expected to return directly after surgery. Therefore, the nurse should document the lack of bowel sounds as an expected finding. On Gail's third day post-op, she is given her first solid meal. 15 minutes after eating, she experiences nausea and vomiting. She becomes very lightheaded and is diaphoretic. Name the intervention.
The answer is B. Explain the symptoms of dumping syndrome.
Yes, dumping syndrome is the most common complication after gastric surgery. It is due to intestinal dilation, peristaltic stimulation, and hypovolemia caused by undigested food in the proximal small intestine. What information should you provide to Gail to help prevent dumping syndrome? Should she decrease proteins and fat in the diet? Sit up in the chair for 1 hour after eating? Drink 2 glasses of water prior to eating? Or eat between 4 and 6 small meals per day?
Decrease fats and proteins. A.
Nope. Gail should actually increase proteins and fats as they are digested more slowly than carbohydrates. To reduce dumping syndrome, Gail should eat between 4 and 6 small meals a day. What interventions could you politely ask a UAP to do while you care for the countless other patients that you have? Hint, there may be more than one right answer. Could she change the surgical dressing on a client with an appendectomy? Assist Gail with ambulation down the hall while using a gait belt? Empty the urinary catheter bag and record the output on post-op patients. Assess vital signs for a client experiencing chills and dizziness. Discuss with Gail the correct way to care for her abdominal wound.
B and C.
Absolutely right. Sterile dressings such as appendectomy, assessments, and teaching are all skills that cannot be assigned to a UAP. Gail is again being discharged to home. Name the discharge intervention. Should she explain that vitamin B12 levels need to be monitored? Discuss the possibility of gaining weight over the next year? Have Gail demonstrate the correct procedure for changing the gastrostomy tube? Or encourage Gail to monitor her blood glucose daily?
Vitamin B12 levels should be monitored.
Exactly. Because Gail's stomach has been removed, she will no longer be able to absorb vitamin B12 any longer. It's still a tight race that anyone could win. What should Gail do while she is at home? Perform active range of motion exercises? Weigh daily in the same clothes? Inspect the incision in the mirror? Or expect full recovery quickly after discharge?
Inspect the incision in the mirror.
Nicely done. Gail lives by herself, and as such, she should use a mirror to view the abdominal incision. If Gail sees any signs of redness or irritation, she should notify the surgeon. And now the bonus question, which does not pertain to Mrs. Lewis, and no answer choices will be given. Contestants may wager only as many points as they have earned. Please make your wager at this time. All right, peptic ulcers occur in 95% of patients with what syndrome?
Zollinger-Ellison syndrome.
Peritonitis.
I have no answer, no idea.
And the answer is Zollinger-Ellison syndrome. Let's review the points. In third place is the blue nurse with 300 points. In second place is the red nurse with 500 points. And in first place with 1,000 points is the green nurse. Congratulations, green nurse. Students, how did you do?